Hello, I'm Dr. Vijay Kataria and I'm a consultant in emergency medicine. I am the Chief Medical Officer at St. Stephen's Hospital, New Delhi. See, when you have a patient who's met with an accident, as it's usually called a roadside accident or a road traffic accident, the impact, these are all high velocity injuries. A person was hit by a force which was high in velocity. He has a fall, the range of fall, how he has fallen, which part of the body struck the ground first, whether he was conscious after that or not. There are a lot of things that need to be taken into consideration. We have to be sure about a couple of things. Number one, the first thing that needs to be, as a bystander, I would say, or as the books, and the textbooks normally say them as the first responders, who basically may not be a trained medical professional or may not be a paramedical by himself. Any person on the roadside, standing on the roadside, is the first responder. Any knowledge of providing a medical emergency help, yes, the person needs to first ensure that the person is conscious or not, and then move about. Ask him to clear the crowd which is gathering around, give him space to move, ask him questions whether he is conscious, is responding, there is no loss of consciousness, his breathing is good, he's able to move his limbs, opens his eyes, recognizes people around him, recognizes the time on the day of the event. Those kind of things are first and foremost. What we call them as A, B, and C, the airway, breathing, and circulation. Those needs to be first seen. Any bystander who is able to appreciate or identify whether the person is breathing, has a good airway, and circulation is good enough. Everybody, all of us know how to feel a pulse. Everybody know how to know whether the person is breathing or not. Yes, if you're able to ensure that, it's good enough. Otherwise, do not make any attempt to change the position of the person. If he's not responding to you at all, he may be having a head injury. Just ensure that his A, B, and C are in order. See, most of the accidents which happen on the road are basically, if you are in a four-wheeler, there are very few chances that in a city driving that the person would actually get injured to a high extent. But yes, a person is walking on the road or a person who's on a two-wheeler, he is the person who has the scope of having a severe injuries. The law by itself has made it mandatory that the Motor Vehicle Act in India has made it mandatory that all people on two-wheelers, motorized two-wheelers, need to wear helmets. And that's one of the very often things that you see, a person who falls off from two-wheeler, he hits the ground. The helmet is, suppose the person becomes unconscious or there's bleeding from any side, from the inside the mouth or from the helmet which you see blood trickling out. Please ensure that the helmet, the neck is stabilized first, and if there's no experience of removing the helmet, do not, I repeat, do not remove the helmet if you are not experienced to do so. If a paramedic comes in the picture and all the ambulance reaches in time, and the paramedic or any doctor on board the ambulance, allow him. He will first of all ensure that the neck is stabilized, his limbs are taken care of, his body is put in a good supine position, and then only the helmet is to be removed. Once you are sure the helmet is removed, the head has to be stabilized. There is no rolling of the head either to the left or to the right. There are packs to be applied at the base of the neck, on the neck, so to prevent any fall, and the stabilization of the spine would ensure that there is no damage further caused by any movement, whether it is fine movement or a coarse movement. Yes, we have to make sure before the removal of the helmet that the neck is stabilized to prevent any further damage to the upper limbs or to the lower limbs.